Questions from members of the Appointments Committee tested the Lejokuku MP's knowledge on the health system in the country, the COVID-19 pandemic, the National Health Insurance Scheme, among others. Responding to questions, Dr. Okoe Boye pointed out the issues that will engage his attention the most when approved as Deputy Minister of Health.
I would support the minister with is to look at what is happening with all these platforms where there's a lot of competency and capacity at the table. Do some harmonization and whisper to my boss some of the things we can or he can do to make sure that there's serious efficiency in terms of harnessing all the output from these platforms. And I believe that that will help us.
He also waded into the debate about who should be considered a frontline health worker.
That you realize that there was mention of an insurance package for all health workers, not only frontline workers, all health workers. That is frontline, middle line, and back line. Those are my other phrases. And the mentioning also of the exemption of taxes. I mentioned on the program that it will reflect in physical cash, so that if you take a net of 1,500 Ghana cedis a month and your taxes were up to 500, for the 3 months that have been mentioned, you're actually going to take 2,000 because the 500 will add. And I stated that that was an admission by the president that all health workers are at some level of risk. Then I added at the program that I go to Lekma Hospital to consult sometimes. Although my risk is higher than a citizen on the streets, the doctor at Ga East, which is an isolation treatment center, sole prepared for COVID patients, those who are positive, my risk cannot be the same as that doctor's or nurse's risk.
Dr. Okoe Boye shared thoughts on how public education can be enhanced in the fight against COVID-19.
I know we are in an era of social distancing. We should not have large gatherings. So it might not be possible to get chiefs and family heads to come and sit, but we can call them. We can use radio. I think radio is powerful. People are listening to radio and watching TV. We can, instead of a doctor from La General Hospital going to a radio station to speak to the people along the coast, we should educate very well a traditionalist who is speaking to the basic measures when he's talking on radio, that keep a distance, wash your hands. This is how we are all saving our lives. Naturally, people will comply. So we should identify messengers who have a link to the people we are targeting, and we'll get results.
In a related development, Parliament has been asked to resume on Friday to, among other things, consider the report on the vetting of Dr. Okoe Boye. After close to 4 hours, this session has ended, and the vetting of Dr. Bernard Okoe Boye, MP for Lejokuku, as Deputy Minister of Health designate, has been completed by Parliament. The Appointments Committee is expected to conclude its report and present to the plenary for deliberation and possible approval when the House is recalled to resume from the suspension of its activities. Reporting from Parliament, my name is Duke Mentokoku.